yourself and tell us what you focus on here at Accent Dentist?
So I'm Matt Sumner. I'm owner and lead dentist here at Accent Dental. I've been up here for 22, 23 years now. And slowly but surely over that time we've narrowed the focus of what it is that I particularly like to do into cosmetic and aesthetic dentistry.
Great. And can you just tell us about a patient you saw this week and what brought them in?
Sure. This is Ben. Ben came to see us because he wanted to come to the home of the Smile Restore so that we could put him back together again. Ben was hit in the face with a surfboard and knocked this tooth clean out. He's a lovely guy, and actually, given what he'd done to himself, he was actually pretty relaxed about it. But over a period of time, we put him back together again, and by putting an implant up in here, and then putting a new tooth on the top of it. And yeah, as you can tell, he's pretty smart, pretty stoked about it.
And how did you choose this treatment option for Ben?
Well, anytime there's a missing tooth, there's really three different options for anybody if you're filling a space back up again at the moment. One is an implant, one is a bridge, and one is a plate. Ben's a young guy. He's a dad of 3 kids. He wasn't particularly interested in having a plate in there. The problem with the bridge is that it often involves taking even a little bit of tooth away. In a situation like this, those 2 teeth are perfect. So there's absolutely no reason why you'd want to put a bridge in there for him. So an implant becomes a really great solution. And in a case like this, having had an accident, ACC was involved in it, which managed to reduce the cost on it for Ben by a pretty significant margin.
Perfect. And Matt, what was Ben's response by the end? How did the experience feel for him?
Well, Ben's a pretty funny guy, and he's pretty laid back. So I had to talk him into making a little plastic partial denture whilst it was healing, because he was actually pretty okay with it like that. But by the time we got rid of that little plastic partial and we got the implant in there, he was delighted. And I've seen him again recently, and he is just going about his life like it never happened, which is really the aim of anything in dentistry. If you can put something in there so that people don't really even know it's there and they can just move on, that's ideal. So yeah, he was delighted.
That's great. And Matt, for anyone looking at getting an implant, what's the best next steps for them?
Well, certainly if it's an accident-related thing, like an ACC case, you absolutely want to get it registered as soon as you can after the accident, because it's quite a process to go through an implant in terms of timing. It can take up to 6-8 months all up. Sometimes even slightly longer, depending on whether there's bone grafting and things like that are needed. So yeah, you definitely want to get it registered with ACC if it's an ACC case. If it's a simple implant case and it's not got anything ACC related, absolutely the best thing you can do is just pop in. We offer a free 15-minute consultation, and we can talk you through some choices. They may not be ideal for you as an implant. There definitely needs to be enough bone there. If there's not enough bone, that becomes quite a tricky thing to do. But yeah, they're a great solution, standalone. What I mean by standalone is there's no impact on the teeth on either side, and they're incredibly durable. One of the most reliable things we do in dentistry is an implant.
Perfect, thanks Matt. And Matt, if people are wanting more information about Accent, what would you tell them?
Well, we've got a great range of case studies on our website, so you should certainly stop and check that out. It's www.accentdentist.co.nz. There's a whole gamut of different bits and pieces that we've put together for people there. It's a great resource, and if you've liked this video, you could like and subscribe to the channel.
Okay, perfect. Thanks, Matt.